Hi, I'm Dr. Pratik Thakkar, MD Dermatologist, owner and Medical Director of the Center of Dermatology Excellence in Mumbai. This very brief talk is going to be about organic acid peels. In this treatment, we use nature-based organic acids designed to work on the upper and middle layer of the skin for various indications. Now, whenever I tell my patients this, the first question they ask is, how is it different from home remedies if it is just nature-based organic acids? Well, we do a lot of home remedies like applying malai, papaya, santra on the face. We also undergo a lot of mask applications, sheet mask, clay mask at parlors or at home. All these have certain natural organic acids which are good for your skin. However, they are present in a very low concentration and hence they mainly work on the dead skin layer. When the same organic acids are used in a much higher concentration, they become a medical treatment because you need a much higher concentration for these peels to penetrate deep and work on the living cell layers. So yes, this is a treatment which is very natural but also very strong, and hence is a medical treatment and has to be done by a dermatologist, cannot be done by other beauty professionals or by yourself. For what all things do we use these peels? My favorite indication is acne. I just love this treatment for almost all my acne patients. Not only does this treatment help shrink your pimples faster, it also removes the marks that your pimples leave behind, and it makes sure that the pimples that you may get in the near future don't leave more marks. Recommended for almost all kinds of acne. It also ensures that your acne doesn't leave scars. Marks, when I say marks, I mean the blemishes, the brownish blackish marks, which peels can effectively remove. However, for scars, you may require a different kind of a treatment later. I'll be talking about that in the demo which follows this talk. Peels can also be used for other forms of pigmentation, for dullness, for rejuvenation, for fine lines and anti-aging. What are the different types of peels? The commonest ones that you keep hearing about are glycolic acid peels, salicylic acid peels. However, today we have a lot of types of peels. A lot of peels are used in combination with each other. A lot of peels are done in a sequential form. So peels is a very broad term, and what treatment you will require varies from person to person. Now, how many sittings do you require and in what succession can you do them? Now that really depends on the indication for which you're doing it. If you're doing it for acne, then generally you require 3 to 8 sessions at 3 to 4 weeks interval. However, if you're doing it just for rejuvenation and glow, you may want to do a couple of sessions at 1 month interval and then do whenever you feel your skin needs a little boost of glow or managing your tan or skin tone in the future. The advantage of peels over other lasers which can be used for pigmentation is that peels is natural and it doesn't aggravate your acne or skin allergies, whereas the heat released by certain lasers can in fact aggravate your acne and hence may not be suitable for these kind of patients with pigmentation. This treatment does have a downtime of 2 to 3 days, in the sense your skin remains slightly sensitive for the 3 days after every session. So you might want to prevent excessive sun exposure, sunlight and sweating, dust exposure for a couple of days after every peel. Other than that, it is not like your face is going to look like a disaster or that you've done something for the days after the peel. Your skin is going to be looking absolutely normal the minute you walk out of the clinic. There are a lot of myths associated with this treatment. Most of those myths arise out of the word peel. A lot of people feel that in this treatment, layers of your skin are going to peel off and over time your skin is going to become thinner. Well, nothing like that really happens. Peels are more like how you would use Drain-X for your pipes. Peels help remove the dirt and dead cells that are stuck between the living layers of cells, so that your skin can eliminate the pigment that is stuck between your skin cells. It does not really make your skin thin. In fact, a lot of peels like glycolic acid peels stimulate collagen synthesis and hence they help maintain the thickness of your skin and reduce the thickness that would normally occur with aging. The other myth I commonly hear about peels is, will my skin become dependent on these peels? What if I stop using peels? This is not, well, let me tell you, this treatment is not something that you are going to require permanently. It only requires the number of sessions to repair a specific problem. After that, you can very well maintain your skin with some basic products like a sunscreen and a vitamin C, retinoid or glycolic acid depending on your skin type. So no, this is not something you'll have to do again and again. This is not something that is going to make your skin thinner. This is not something that is going to make your skin sensitive and irritable. If at all, it's the exact opposite. Now the biggest challenge we face today as far as these kind of treatments are concerned is unauthorized people doing these treatments. There are a lot of unauthorized certification courses which trains non-medical beauty professionals and even non-dermatology doctors into these treatments. Please understand that in the West, parlors and beauticians are already doing this treatment. In India also this trend has started. Like I said in the beginning of this talk, even though this treatment is completely natural, it's significantly strong, and if you don't do it properly, don't do it with proper training, you can end up getting a burn on your face, and these burns and side effects are almost exclusively seen when untrained people do it. We've been doing it for years. We would never give you a burn, but please refrain from doing this at beauty parlors. This talk is going to be followed with a very quick demo so that you get an idea of what this treatment actually is, because I know from the description it sounds a little confusing. So see you at the demo. Now I'm going to take you through a quick demo of how this treatment is done, because I understand the word peel might be scaring some of you off. You might be wondering, is this a painful treatment? Is something going to peel off my skin? It's as simple as me applying something on your skin, leaving it for some time and then neutralizing it. During the treatment, the patients experience a mild tingling sensation which completely goes away as soon as the peel is neutralized. So come join me for the demo. In this video, I'm going to quickly demonstrate to you how we do a peel. Now let me make it clear, this is not a training video. It is not intended to train untrained professionals in doing a peel. So I'm not going to give you detailed steps. This is just to show my patients how simple this treatment is and that they have nothing to be worried about. In this lovely volunteer of ours, we are going to do a peel mainly to shrink her pimples faster, to make sure that the pimples don't leave marks, and to remove the marks that the pimples may have already left behind. This is not her first treatment, this is a fourth session, so most of the marks of the peels have already been removed. We have already prepared our volunteer, we have degreased her face, we have cleansed her face to remove the excessive dirt and oil, and I'm directly going to start with the medical part of it. So we have two peels ready here. One is a lactic acid peel and the other is a combination of mandelic acid and salicylic acid. The first peel I'm going to do is a salicylic and mandelic acid peel. This not only opens up all your pores, it also shrinks the pimples, it kills the pimples causing germs, and it has a lovely exfoliating effect so that the pigmentation doesn't stay behind. As you can see, there is no amount of pain involved in this treatment. The volunteer is completely comfortable. It may tinkle a little, it may burn a little, but that's about it. So after leaving the first coat of peel on for a preset amount of time, we are now going to neutralize with our preferred neutralizing agent, which is different for different peels. As you can see, the patient is still very comfortable. There is no redness, there is no pain, and you don't see anything coming off. We are just removing the excess organic acid that has not been absorbed by the skin. So after the peel is neutralized, the patient may have a little warmth, a little irritation, tingling or burning, which is taken care of by a simple sanitized ice roller. So the first coat was a combination peel of mandelic acid and salicylic acid. The second coat is a high concentration lactic acid. Lactic acid is a very good hydration agent, so it leaves your skin feeling hydrated. It gives your skin an instant glow, which is why this peel is also called a party peel. So you've seen a combination peel, you've seen what a sequential peel is. Now this peel, apart from the face, is also done for other areas like darkened underarms, pigmentation of hands and legs following insect bite, dark circles where you might not want to do a laser very close to the eye, and one of my favorite indications for excessively dry and chapped lips. Lactic acid hydrates and makes your lips glow better than most other treatment modalities. Thank you for listening.